Evan is a 3-year-old male who was referred by his preschool teacher for concerns regarding his expressive and receptive language. It was reported that while he can identify 10 body parts, he only says the names of 3, and he also inconsistently names the colors red and green. At daycare, Evan makes requests using gestures and one word. However, his mom and dad noted that they only observe him pointing and crying to make requests. Receptively, Evan takes a long time to respond or will not respond at all when prompted to identify objects or point to pictures while reading. He was born 1 week after his suspected due date, but prenatal and birth histories were unremarkable. Evan weighed 8 pounds 3 ounces at birth. His mother reported that she experienced no complications throughout her pregnancy or during delivery. She also noted that Evan breastfed for 6 months and then transitioned into bottle feeding. He experienced no difficulties feeding as an infant. Evan's mother reported that he reached fine and gross motor developmental milestones at a typical age, but did not say his first real word until after 2 years of age. She also noted that he experienced multiple occurrences of otitis media between the ages of 6 months and 18 months. He is otherwise regarded as a healthy toddler. Evan currently attends preschool, and this is his first speech-language evaluation. Evan was observed for 1 hour in his preschool classroom by the clinician. While he appeared to be an active and playful child who likes to run and jump, it was observed that Evan only played with the train toys in the classroom. When his preschool teacher tried to direct him to a non-preferred activity, Evan would begin to tantrum. It was observed that he would sometimes use gestures and one word to make requests, but would also point and cry to make requests as well. To choose an object, Evan would typically grab at them and tantrum if the objects were withheld. When reading a story during circle time, Evan would take a while to respond or not respond when asked a question by his preschool teacher. Oral structure, articulation, voice, fluency, and cognition were all informally assessed and were found to be within normal limits. Vocabulary was found to be limited, and it was also observed that Evan did not often respond when asked to identify objects during play. Evan's pragmatic skills were also informally assessed, and it was noted that Evan tantrums when preferred objects are withheld. The Preschool Language Scales 5th edition was administered to assess Evan's auditory comprehension and expressive language skills. He received a 69 on the auditory comprehension component and a standard score of 65 on the expressive communication component. These results represent that Evan's performance in these areas is more than 2 standard deviations below the mean. This is indicative that Evan is performing moderately below average. A language sample was also obtained during play. The clinician engaged Evan with familiar and preferred toys and activities. Results revealed no elicitation of verbally requesting objects or items and a mean length of utterance, or MLU, of 2.5. Evan presents with a moderate expressive and receptive language delay characterized by his scores on a formal assessment, a low MLU, and his inability to verbally request items or identify objects. Evan has a good prognosis for involvement in the areas of expressive and receptive language. Although he is not verbally requesting objects or items at home, it was observed that he is doing so in the classroom. This is indicative that he has the ability to verbally request instead of pointing, crying, or tantruming. Evan is currently in a language-rich environment in his daycare setting and has a good support system in the home environment. Recommendations for Evan include individual weekly 1-hour therapy sessions. Expressive language targets should include labeling objects, making verbal requests, and expanding his MLU. A sentence strip can be utilized within therapy to elicit verbal requests while simultaneously expanding his MLU. Receptive language targets should focus on identifying and pointing to objects when named and pointing to objects when reading a story. A behavior modification system should also be implemented during therapy to eliminate tantrums. This can all be facilitated through play-based therapy and incidental teaching within Evan's therapy sessions.